Okay, this is Ethan Moore. I'm going to be demonstrating my cradle techniques for breastfeeding, my bottle feeding techniques, my bathing skills, and latch techniques for the care of a newborn. So first, you want to be sure that the mother is either sitting or in bed, and then you want to be sure that you're offering her pillows so that she's comfortable and can stabilize herself. So our first position, our breastfeeding position, would be the cradle position, where you're supporting the baby's head in the curve of your arm and supporting underneath. And then we have the modified cradle position, where you're supporting the head with your right hand and kind of pulling the baby's body over yours, like a sideline position. And normally you would have a pillow here to support. And you're, like I said, you have your hand on their head supporting this side, and you're cradling up under. And be sure that you have the nose aligned to the nipple. And then for the football holding position, you would move it to the side that you're going to be feeding from, and kind of tuck the baby up under your arm. And again, support the head and hold up under with the opposite arm. And again, being sure the nose is aligned with the nipple. And then the sideline position, the mother would be in the bed or laying on her side, and the baby would be laying right beside her. The mother would be laying on her side, and the baby would be laying on her side, and you'd support their head and again align the nose with the nipple. And of course, with every technique, you want to be sure that the baby has a good seal. So you'd want the nose, the lips, and the cheeks and the chin to all be making a seal over the nipple and part of the areola. And because if not, the mother could get sore, and she would tire out quickly and things like that. So then for the latch techniques, to introduce the breast to the baby, you could use the C-latch technique, which is like this. And then you would introduce the nipple to the baby. Or you could do the U-latch technique, which is like up under the breast, and introduce the nipple. And there's also one more, the scissor latch. You would separate your fingers, which would be small, which is a little bit harder and would definitely be harder for mothers with smaller hands. But to demonstrate that, you would use the C-latch to introduce the breast. And again, be sure you have that good seal. And then for bottle feeding, you would want to be sure that the baby again is in the cradle position, and that you're supporting the baby's head with your arm, the crease of your arm. And I don't have a bottle, so I'm going to use a prop bottle. But you should again be sure that the baby is propped up against your arm, so that everything is flowing down, and that you're and this promotes because if the baby was laid flat, that would promote reflux. So this promotes the everything you feed the baby to go down in the proper position. So you would hold the bottle at a 45-degree angle. And you would always be sure to never lay, like I said, the baby in the supine position for reflux reasons. And you'd also be sure to never prop the bottle with the baby. You'd always need to be sure that there's liquid in the bottom of the nipple, so they're not sucking in air, because that might cause distress later. And then for burping positions, you would need to burp every 2 to 3 ounces for the bottle. And then if you're breastfeeding, you would need to burp between switching breasts. So the burping positions would be, you would have your burping cloth over your shoulder, and you would support the baby like this, kind of lean back, and just burp the baby like that. And if that wasn't working, then you would move the burp cloth kind of to your knee, have the baby in a seating position and kind of leaning over. You would support their head and neck with your hand, and then you'd burp them this way. And when you were done burping, you would never just lay them immediately down. You'd want to keep them up for 10 to 15 minutes just to be sure that all the gas is gone and that they don't have any reflux. And then for bathing techniques, to do the sponge bath, You would need 2 separate blankets, 2 washcloths, a petroleum-based lotion if the baby had dry skin. And then you would need a basin filled 5 inches full of water from either 100.4 degrees to 104 degrees. And you would use 2 washcloths. And to promote the baby keeping their heat, to prevent heat loss, you would do the sponge bath when the baby was wrapped in a blanket, had a t-shirt on, and a diaper. So, of course, you would keep them wrapped up and in a comfortable position until you started bathing. Again, keep them wrapped up for heat loss, to prevent heat loss until you're ready to bathe that part. So you would then wet your washcloth, and then use a washcloth use a different washcloth for each eye. So you would start by washing the eyes from the inner canthus to the outer canthus to be sure that you were preventing any clogging or infection of the tear ducts or lacrimal glands. And then you would use, again, your second washcloth and wash from the inner canthus to the outer canthus. And then you would rinse again. And then wash the external part of the ear, the auricle and the pinna. And then you'd wash the behind the ears on each side. And then you could wash and dry the rest of the face. And then you would need to rinse again. And wash the neck, especially in the skin creases where formula could collect during feedings. And then when you are ready to wash you be sure to wash and dry the face, ears, eyes, all of that, and neck. And when you're ready to wash the upper body, you would of course keep the lower body wrapped still in a blanket. So you would expose the upper body. And then you would wash, rinse your cloth. And then you would wash the chest and the back and arms. And then you would, of course, rinse that and let it dry. And then you would wrap the upper body in a clean, dry blanket. And then you would unwrap the lower body and expose the lower extremities. And then you could wash the legs and feet, the lower body. And you would then wash, rinse, and dry that off. If they had any dry skin, you would need to use a petroleum-based lotion, because powders could be dangerous for respirations for the baby. And then if you were going to do genital care should be done for every diaper change. But if you were going to do it again at the sponge bath, you would need to just use water and a clean cloth. And if it were a female baby, and you would clean the vagina from the front of the perineal area to the back towards the rectum on both sides, and then in the middle. And then for the penis, you would of course wash it and rinse it with just water, but it would need to be a really wet rag for both. And then you would need to, of course, dry and reapply diapers or any lotion or any other care they may need from there.